Thank you. Right. So I'm Dan Morgan. I'm going to talk to you about how I found myself building a game, something that no one I know or myself really thought I'd ever be doing. So starting out, I'm not like most of the people here. I'm a doctor. We're kind of serious people. Most of us don't spend that much time playing video games. And, the closest I came to this really was probably in high school, falling asleep on the couch while people played Mortal Kombat. But desperation leads you to unexpected places. And 20 years ago, I saw a woman who was misdiagnosed with a blood clot to her lungs and given dangerous therapy. I was called in the middle of the night when she couldn't move her arm or leg. And it turned out that what we gave her is what was hurting her, the blood thinner, and she did not have a blood clot, but a bad test used incorrectly. And that led to bleeding in her brain, and eventually her death. So you can see the white parts here are the blood that's in a scan from a patient like this. And so this stuck with me over the years in trying to figure out what could have happened differently. How could this have not happened? And while I was developing a research career, I was thinking about it, but it wasn't clear how you could research this. It turned out this was something called diagnostic error that has received extra focus. And then 7 years ago, I was lucky enough to get an NIH grant where I could really delve into this. So we tried to look at why doctors are bad at diagnosis and how that can be improved. And we asked over 500 doctors around the country, very simple cases, like a 40-year-old woman with chest pain, does she have a heart attack? Should be a very low-risk patient. But what we found is that doctors tended to really overestimate the chance. So their estimates are in red, and the reality is in green. And we found they overestimated, especially after a positive test result. And this happens with other conditions, too. And why does this happen? There's probably some myths in medicine. There's the myth of the medical detective that's been present for hundreds of years, and then the interpreter of technology. Neither of which really capture what we do in medicine, but can lead us down the wrong path. But the key thing is that doctors don't learn probability. It's taught as mathematical formulas or 2x2 tables that you can use on a test, but you can't use in fast pace of real-life medicine when you're seeing patients. And in reality, probability is central to how we do testing and treatment, and testing changes the probability, but there's always uncertainty that we need to be aware of. And that can be interpreted with Bayesian updating. So we talked to experts, and psychologists have really looked into how we can teach Bayesian updating. And there's three key things. It needs to be made intuitive, so rapid. It needs to be done with visualization, and then feedback, which we actually don't get that much feedback in day-to-day medicine. So this is why we ended up making a game. And this is the first version, which I was proud of because it actually worked, but obviously we needed help. And so while I'm not very good at gaming, I'm good at connecting with people. And so we found some graphic designers from Philadelphia, Beth and Renee. And then I'm good at projects, probably from a childhood, being homeschooled and doing things like building tree houses. But really the key connection was in Baltimore. We found a group that does gaming, Mike Legrand with Firaxis Games, and a non-for-profit that he and his wife run is teaching high school students how to do coding called Code in the Schools. And Nick, up in the corner, was their star student who was finishing college. So he started working with us, and over 3 years we built this game that tries to teach doctors how to do diagnosis. So you're presented with a patient, the test itself, and then asked to give an answer immediately of how you would interpret this test. And so this time I guessed too high. I guessed 20, and it was lower than that, so it gave me feedback. But then I guessed again, and it was 10%, and that was within the range to appear on the target. But then I got exact feedback on how to get this answer. So finally, when we finished this game, we decided to see how it worked in real life and tried it out in medical people. So we did a rigorous randomized controlled trial of medical students, residents, and doctors, trying to look at playing the game for an hour versus the standard education we give. And then we tested them for diagnostic accuracy immediately after, and then 1 month and 3 months following that. And these are the results. And what you can see in blue is that the doctors who were trained on the game, who did game-based learning, had a diagnostic accuracy score nearly twice as high as those people who had traditional education, and that persisted. So in summary, a game does make doctors better at diagnosis. I'd encourage people to try it out. It's online. We're looking for collaborators to improve it. And my dream is that this could be used by people around the world to make better diagnoses and take better care of people. Thank you.